Joining us now, the Greater Chennai Corporation Commissioner, Mr. Gagandeep Singh Bedi, on the launch of what they call as special COVID ambulances or core ambulances in Chennai to expedite treatment and also which makes home triage possible in the city. Thank you very much for your time. How does the model work?
The model is like this, that all the people who are positive in the city, they are informed by the corporation's sanitary inspector in the morning that you are positive, and thereafter we send our doctors teams to those to every person's house, who go in PPE kits, and then they examine the oxygen level, the temperature, the blood pressure, and then they decide whether the person has to be in the home or he needs further screening, whether to be decided to be taken to a hospital or a COVID care center. Now, for suppose somebody is comorbid, he or she is having symptoms, then that person has to go to our screening center where we have our mobile X-ray, where we have our X-ray unit and the blood testing kits. For that, we don't want the patients to be taken to that place by the relatives, because then the relatives can also get infected. So for that, we have got our special COVID ambulances of Greater Chennai Corporation, wherein the driver's area is totally medicated and separate from the passengers area. We have a partition over there. The patients are taken en masse over there in that street, and then they are tested, and thereafter, if they have to be hospitalized, they are sent to the hospital or COVID care center, or if they have to be put in the home isolation itself, they are dropped back in their houses. So the basic point is that we don't want to stretch out our 108 ambulance system. We want our 108 ambulance system to be free for the other patients or more serious patients. And for testing alone, Greater Chennai Corporation wishes to chip in and ensure that we help the system. At the same time, we also keep the relatives free from cross infection.
What would this mean for the patients?
For the patients, one, he or she will have an immediate of course, our triage means he or she will immediately be seen by the doctor. And secondly, he or she is immediately taken up by our COVID ambulances to the nearest screening centers, and from there they are dropped back over there. So he or she need not have the botheration of ringing up for the ambulance to come from the general health system, and the Greater Chennai Corporation keeps the health system ambulances free from all this burden. Because during the last second wave, we found that at the peak of the system, getting a 108 ambulance was itself a big struggle for many of the patients. So in anticipation of that, the Greater Chennai Corporation felt that it's better to put the system right in place when the number of patients are increasing, so that the patients are not put to the hardship.
The numbers are crossing 2,000 every day. Does the corporation have enough manpower to visit these patients every day, every morning?
We need more manpower, and Government of Tamil Nadu has actually given us a go-ahead, and we have recruited 1,000 COVID volunteers who are going house to house in order to touch base with each and every COVID patient. On the first day, give them medical kits as well as the yellow bags for the disposal of COVID waste. Then they visit every day to check their oxygen level and their other health parameters. Right now, we are having 1,000 COVID volunteers, and the government has given us a go-ahead to further recruit temporary staff in case we need further, if the numbers are increasing and if we need further support. Yes, we are willing to go ahead that, and we will take doctors. Right now, we have our system and our mini clinic doctors also. We have put them all on triage. We are having more than 300 doctors already in Greater Chennai Corporation. Today, our health secretary also, I asked for another 100 doctors into the system for their field triaging, and they are reporting to us by the evening. So I think Government of Tamil Nadu is giving all support, and if needed, we will hire further doctors also across the further weeks.
So we are under the third wave. The numbers in Chennai have already crossed 2,000 every day. What's the projection we are looking at?
The numbers, as per we are in touch with ICMR experts. First, from the metropolitan cities, they say, of course, because there's a lot of high population over here. Chennai itself has a population of more than 85 lakhs at present. The numbers will increase. Sharply. That's what they are saying. But then, as per the ICMR experts' projections, it will also decrease down very sharply. So that's what has been the trend.
What's
in
the
other
number we are
parts.
looking at? Last time it was beyond 7,500.
7,500 right now. Of course, we are having about 2,000 plus. If this trend continues, see, the city as well as government of Tamil Nadu is putting a lot of restrictions. Our honorable CM has already put up COVID lockdown. We are stressing every day. We are fining more than 8,000 people for not putting the masks or not putting masks properly. We are also watching all the marriages, all the gatherings. We are putting all the fines. But whatever said and done, because of the present infectious nature of the virus, the numbers are increasing. We can definitely cross the figures of we'll cross the figures of last virus. But at the same, the good thing is that at present, this virus strain has not been as damaging to the human health. We expect that it should be, we hope and expect that let it be there like that only, but we are not taking any chances. In fact, we have now set up a new COVID care center at Chennai Trade Center where Honorable CM went with more than 800 beds over there also in place, and we are setting similar systems all across the city also.
Last time during the peak we had 7,500 cases. Now how well the city is prepared? What are in terms of oxygen supply, ICUs and beds?
We are having the previous system, we are having the same system at present also. Like as I told, we had Chennai Trade Center, 800 beds, we have set up the 800 beds over there. Today the oxygen is also being put up in the COVID care centers. The city's medical colleges, the health department is taking care. The oxygen supplies have already been increased. The review is directly from the CM and Health Minister itself, and the Chief Secretary is also reviewing. We have seen that we in Greater Chennai Corporation, in our COVID care centers, etc., we are having 1,000 plus oxygen concentrators, and which we have again ensured that they are all in all readiness. The beds are there. We are still, we feel that we should have further beds also in readiness, so that we should not, none of the patients should have any shortfall in case the need be. We are further expanding our system beyond the last time levels, but we hope that there will be not much of hospitalization and most of the people will be in home isolation as the present trends go.
COVID SOP compliance still remains to be a major challenge. Many are not adhering to that. What are your concerns and something you think as challenges?
One positive thing is that a lot of people have got vaccinated. Tamil Nadu government has given a lot of focus. There have been mega vaccination camps, and we have got first dose in Greater Chennai Corporation itself is more than 91-92%, and second dose of vaccination also touching over 70%. So that's good. A lot of messages have been given to the public through the media, not by the chief minister, by the popular personalities across the state, right, to wear mask. But masking is something now with the rise in COVID patient cases, the people are actually concentrating on the masks. But yes, masking up is a big challenge for us, number one. Second is a lot of crowding this is a festival season. December, January, a lot of challenges. There's Pongal festival coming, so there'll be a lot of crowding, and of course government has also put up a lot of restrictions. Beaches, we don't allow people on the sands, etc. But despite that, sometimes many of the families, many persons, they take it lightly. They eat together, remove the mask, sit together, eat together, congregate. They feel that the government is unnecessarily being strict. There is nothing that can happen. People don't understand that in case of COVID, a normal person might bear, but a person with comorbidities, he's at a great risk, and one should not take all these risks. So these are all the challenges. Large section of the society, I feel, do conform to the governmental guidelines, but a small section is always there which does violate, and that's our challenge.
Lastly, from tonight, the 10 a.m. to 5 a.m. curfew comes into force. What time are shops, business establishments expected to shut down?
So 10 a.m. to 5 a.m. if it is closed, so the shops will have to close before 10, and then they have to go, shopkeepers have to reach their home. Broadly, this is to ensure that all those night crowds in shopping complexes or in clubs or other places are avoided. So that's a way the government can actually make small restrictions. by not affecting the livelihood of the general
Right.
population, at the same time ensuring that unnecessary gathering of the people during the night times is avoided. So people have to close their shops, as I have already told, well within time, so as to reach their houses by 10. That's what we'll advise everybody to do so.
Thank you so much, sir, for your time. That was Mr. Gagandeep Singh Bedi, the Commissioner of Greater Chennai Corporation, talking to us in Chennai with Suresh, Sam Daniel, Find It TV.